Welcome everybody. I am Dr. Shashank Joshi. You are watching the 356 non-stop edition of Dr. KK Agarwal's MEDTalks show. The headlines for the day. We know that COVID is still around, and right now, as we talk today on the 6th of July, a preprint study which was conducted in more than 100 health in 3 centers in India showed that the Delta variant of coronavirus is 8 times less sensitive to antibodies generated by vaccines compared to the original Wuhan strain. So the study was titled COVID-2B612 Delta variant emergence and vaccine breakthrough collaborative study, and it was done together with the scientists from Cambridge Institute of Therapeutic Immunology and Infectious Disease. Just like India had faced a severe oxygen crisis, Indonesia now is at a peak and they are facing a severe oxygen crisis during the skyrocketing cases in the country, again driven by the Delta variant. The country has reported around 30,000 new infections and 558 deaths on Monday. India is continuing to break records in vaccination, having crossed the fastest country on planet Earth to vaccinate in terms of sheer numbers. And we have now crossed 35.75 crores with over 45 lakhs vaccine doses being just administered in the last 24 hours as per the Ministry of Health. We also know that England is still bracing for a fourth wave, but they are trying to ensure that they had gone to a no mask policy, but they are making wearing masks voluntary and required 1 meter social distancing rooms. But they have to be very cautious because they are little worried about the Delta variant. We know that there was a big hue and cry in Singapore. They were investigating a 16-year-old from an out-of-hospital cardiac arrest 6 days after he got the first Pfizer BioNTech dose to determine whether there was linked with any COVID vaccination. He was always engaged in strict workout, lifting very heavy weights just prior to his collapse and is in critical condition in the National University Hospital. So Singapore Health Ministry has issued a guidance that Indians and young men below 30 should avoid strenuous physical activity for 7 days as a precaution after getting their first or second dose of the COVID vaccine. So today's topic for discussion is the COVID vaccine. So let us go to our, we know that we are doing this show jointly with Dr. Rahul Pandit. We all know Dr. Rahul Pandit is a very active member of the Maharashtra as well as the Superintendent National Task Force. He's also the Director of Critical Care at the Fortis in Mumbai. Thank you, Dr. Rahul Pandit, once again to joining us on our show. And let us now ask Dr. Rahul Pandit his take on the vaccination. Two big news came out this week. One is vaccination for pregnancy in India. How do you view the vaccination for a woman in India for the pregnancy? And second is, in the pregnant state, what would be your vaccine of choice? Dr. Pandit.
Thank you very much, sir, and good evening, everyone. I think it's a very important decision which India has taken, that we have allowed vaccination now for our pregnant women. And, there is this notion that pregnancy may have basically got some issues with the baby being there, whether the vaccination would be safe for them or not. But remember, if the mother is safe, everybody is safe. The baby is safe, the whole family is safe. So the mother has to be the safest person, and it is very pertinent that the FOXI, the Federation of Obstetrics and Gynecologists of India, way back 2 months ago had actually made a strong recommendation. And with the data emerging, India has now allowed pregnancy to be a part of the vaccination campaign as well. And I think that's a very positive step. Now, coming to which vaccine would be the safest vaccine to use, I think we need to use a vaccine which is giving a wide coverage, has got a good efficacy, and obviously will not harm the mother or the baby as much as it can. Now, none of the vaccines have shown any harm, but even the small side effects with some of the vaccines which may get, like fever, for example, may be an undesirable side effect, and we will not want that to happen. So I think the safest vaccine to take up, in my opinion, would be a Covaxin followed by Covishield. Not enough data is available about the Sputnik at the moment about whether that would be as safe as the other vaccines or not. So these two would be the best vaccines to sort of take up, Covaxin followed by Covishield. And that would be my opinion. Obviously, as the newer vaccines come up, and when I say newer vaccine, I'm talking about the second generation vaccines, which are now being developed. They would be more safer across the length and breadth of the population, which would include children, pregnant women, and adults. and that would, I think, be a game changer. But until the second generation vaccines are launched, we need to be probably start concentrating on Covaxin followed by Covishield. Sir, I would like to ask you a question, which I think a lot of our viewers may be, probably having it in mind, but may not be aware of to how to sort of put forward. What is the current vaccination status of our country? And we are talking at these three vaccines which are already available with us. Sputnik being the new launch in the last month or so. Where are we looking at in terms of covering up our Delta strain and the Delta plus strain? And then when do we reach to that magic figure where we say that we now start looking to be safe as a country?
So, Dr. Pandit, this is a very good question. We are around 135 to 139 crore Indians. So we need to reach that magic is 100 or 110 crores Indians, either to be exposed by natural infection or to be vaccinated through vaccination program. Currently, as we stand, we have around 35 crore Indians who are being vaccinated with at least one dose. Now let us look at the split breakage of who has got vaccinated and how much. So our vaccine program started on the 16th of January. On 16th of January, we started with healthcare workers. We have around 1,70,000 plus healthcare workers, and we have vaccinated a large proportion of them, 1 crore 70 lakhs. So that healthcare worker proportion, the second dose is maybe missing in a small percentage of it. We have equal large proportion of the frontline workers. Again, we have vaccinated a substantial proportion of the frontline workers with two doses, but maybe around 20% of our healthcare workers as well as frontline workers are still not vaccinated with the second dose. Then we have people above 60, and probably a large percentage, at least 70% of our people above 60 have been vaccinated with both the doses. So getting both the doses in place is very, very crucial in order to ensure that we are protected from the Delta plus variant. Then the third population is between 45 and 60 and between 18 and 45. So we need to protect our vulnerable population as quickly as possible, as fast as possible. So Government of India now has four options of vaccines. Of which three are available now. The first being Covishield. Two doses have to be given 84 days apart. That is the largest prevalent vaccine today in India. Probably that dose could have been shortened, but because of the availability and larger coverage, they have kept a larger distinct. From a scientific standpoint, that dosing strategy is appropriate, if you ask me, because you get a larger boost in the second dose. As far as vaccine is concerned, it's a 1 month apart dosing strategy. As far as Sputnik is concerned, it's a 1 month apart dosing strategy. And the fourth vaccine, which is going to be available in India, is Moderna. It has got permission. It's coming from United States as a donation. Will be available in various government hospitals next week. And the fifth vaccine, which will also be getting approval from DCGI, is a Zydus vaccine where we have to give 3 doses. So remember that definitely we are progressing fast. And in the next 3 months, we need to at least vaccinate 80 lakhs to 1 crore vaccines per day. If we are able to get to those 90 to 100 crore vaccines in 3 to 4 months, we will saturate and unlock appropriately with a very small truncated wave. Our idea is that our third wave or fourth wave or fifth wave which comes should not have severe disease, should not need oxygen, and should not have caused deaths. We need to save every death with COVID now, and from that standpoint, we are marching in the right direction. Supply crunches, there are availability and access constraints, but I think India probably is leading the largest vaccination program on planet Earth, and it is progressing pretty well. So, Dr. Pandit, a couple of questions for you. Daga is asking, Mr. Rajendra Daga, that the antibodies, we develop antibodies against coronavirus. How are the antibodies developed from vaccine different from the ones which are developed from contracting Dr. Pandit? You are muted, Dr. Pandit. You are muted. Rahul, you are muted.
Yeah. Sorry. Very,
So
very
the
nice
Pandit,
question, Dagaji. Can you hear me now, sir?
yes,
Yeah. So it's a very important question to understand as well, that why are the antibodies different from the vaccine as well as versus the one which we develop after we contract a live virus? Well, when we contract a disease, when we contract any viral disease, not just COVID, but let's say H1N1 influenza, whatever it is, the body has its own protective mechanism. And then the body starts producing some amount of antibodies, like we said. Antibodies means some fighter cells in our body which will actually fight against the virus if it comes and attacks the body again. These are typically called as proteins or antibody proteins. Now, these, when the virus infects you, what your body produces is a whole lot of proteins, which can be a combination of IgG, IgM. But what is important is the proteins which will actually neutralize the virus when you have an infection again. And that's called as a neutralizing vaccine, neutralizing antibodies. When the vaccines are given, they are made in such a way that the body would produce neutralizing antibodies. And that is why the vaccine antibodies are far superior as opposed to the antibodies produced by the disease itself. Of course, the disease also produces some amount of neutralizing antibody, and the response can be varied between individuals. But vaccines produce predominantly neutralizing antibodies, and that is why it offers a protection. That's the biggest difference between the two. And that's why we say that even if you've had COVID 19, wait for 3 months, and then after that, go ahead with your vaccination schedule. Do not consider yourself to be completely immunized just because you've got a COVID 19 disease. And why 3 months? 3 months to 6 months is the time where the antibodies may remain in your body, and after that, they may start going down. So, we don't want to leave any ifs and buts. We want to have it very, very clear, and that's why we need to do that. Okay. Another question,
So Rahul, one
sir.
more question. 1 minute, Rahul.
Sure, sir.
One more corollary
Sure.
question. Satyam Agrawal ji is asking, can a reinfected person transmit the virus?
Okay, so a person who gets a reinfected person is defined as a person who had COVID 19 before, and then unfortunately has, after recovering completely after several weeks or months, he has got the infection again, and maybe he's asymptomatic, or maybe he's mildly symptomatic, or even properly symptomatic. That also is possible. So the answer is a reinfected person can definitely infect and transmit the virus to other people. That is definitely something which we know can happen, and hence we seek that even if you've had COVID or you've taken the COVID 19 vaccine and you've completed a vaccination schedule, please wear a mask, because you are still capable of getting infected, and you may not realize that you have an infection, and you may pass it on to your near and dear ones, especially to the people who have not had COVID before or who have not been vaccinated. And in them, this virus may actually create some problem for them. So there are two questions which are there for you. Pradyuman Singh is asking, what is the status of international approval for Covaxin and Covishield, and when is it expected to happen? Because a large number of employees, students are waiting to join many foreign countries as jobs and as students in the other countries. And similarly, Anjali ji is asking, my husband's taken Sputnik on the first dose on the 25th June. Yesterday, he saw some dead skin in his beard when he rubbed this. It probably became a bit red. Is this from the vaccine? Is this rash something to do with the vaccine? I think two very important questions. First one to do with the ease of travel for people, and the second one to do with the safety of Sputnik.
So Rahul ji, Pradyuman ji asks a very good question. It's a question which is asked to us by all of us. So Covishield is approved for WHO. It has met the WHO pre-qualification requirement. And which of the countries they are allowing somebody to fly with it. But remember, currently from India, as Indian citizens, we can only fly to 4 or 5 countries, which include Mexico, Serbia, Kazakhstan, etc. So we are not allowed to fly right now as of today. There are a lot of restrictions. If at all you have to go with a special permission, then probably they will need to do a test 72 hours prior, and you will need to do a strict mandatory 14 to 21-day quarantine. And over and above that, if you have Covishield, it will be useful. Covaxin has also for the WHO pre-qualification. It will come in 2 to 4 weeks, but it will take some time. So between Covishield and Covaxin, currently, that standpoint, it is there. Now, many European countries are allowing even Covishield. They want the Astra vaccine, which is made by in UK and not made in India. That also, Government of India and Ministry of External Affairs is in active negotiation with various European countries to relax that now. So currently, it is Covishield, and Covaxin will also get it, but it will take probably a month to now. The second question which Anjali ji asked is there is a potential that this could be related to vaccine. Vaccine can cause occasionally skin lesions. In fact, just today, the AIMS Bhubaneswar team has published the first case of Stephen-Johnson syndrome after a COVID vaccine. One has to be vigilant, but one doesn't have to panic. Occasionally, extremely rarely, you can get occasionally skin eruptions, but usually what you are describing to me, madam, does not likely to be vaccine related. So Rahulji, two questions. One is by Anjali Sharma that my brother had pneumonia due to COVID in before he got plasma therapy also. Can he take Sputnik now, which has AD26 and AD36 and AD5 virus, which belong to cold, very harmful. So if somebody has had a severe COVID, somebody took plasma therapy, people are scared to take Sputnik. So what is your this thing? And the second thing is asked by Bindu Agarwal ji. And Bindu ji is asking a question that I got my first vaccination in March, but caught COVID after 12 days. After 3 months, I got my antibody test. Now my antibody test is 694. How to go for my second vaccine and will it be safe?
I think both the questions are very important. Anjali ji, thank you very much for asking this question. So the two viruses which are acting as a vector in the Sputnik V vaccine are the influenza and the adenovirus vector, and both of them can cause some amount of infection as a individual virus. But remember, when they are used in a vaccination trial, when a vaccine program, they are non-replicating viruses. That means that by them themselves, they will not cause any infection or harm to any person who takes it. So the answer for your question is, please go ahead and take the Sputnik V vaccine if it is available for your brother. It is going to be absolutely safe. It has got absolutely no bearing. So coming up to a question on the plasma therapy, we commonly say that if somebody has received plasma or somebody had COVID-19, wait for 3 months and then please go ahead and take your vaccination schedule as it would normally be scheduled for you. So after 3 months, your brother can certainly take the vaccine and he can most certainly take the Sputnik V. For Binduji, I think it's a very important question again. Uh, I would like to clarify all of our listeners and viewers and friends. You are almost like family to us. I would not get my family's COVID antibody done before a vaccine. So please don't do an antibody. It will just confuse you. You are absolutely fine to take a vaccine after 3 months. Since you had your first dose in the March and then you had COVID-19 after around 12 days, and now it's 3 months past that, please go ahead and take a vaccine. In fact, today itself, there is a study published by ICMR, which me and Dr. Joshi were just discussing 2 minutes before the start of the show, which Dr. Joshi had posted on one of our groups, which shows that people who are having both doses of their vaccine done and had COVID-19 as well, probably in between or before the vaccination, had a better protection against the Delta and the Delta plus strain. So you should go ahead and take the vaccination. That's the study from ICMR, hot out of the press today. So that's what we need to understand. So, sir, there is a little bit of a confusion still among people. I would like you to please enlighten everyone about the 3 or 4 different vaccines which are available now. The 3 which are available and Moderna which will be coming very, very soon. Because the question asked by by somebody from Madhya Pradesh is that which vaccine is better? Covaxin, Covishield. Somebody will ask Sputnik, then they would ask about Moderna. So, is there anything to sort of say that this is one is better over the other?
So the answer to that is very, very simple. Take the vaccine which is easiest and fastest available to you, and you can finish both the doses quick and fast. So that is all the vaccines are equally safe, all the vaccines are equally effective, all the vaccines have their own cons. So that is something which is there. Currently, we have to ensure that everybody gets vaccinated quick and fast. So let us look at each vaccine, the pro and con. The pro for Covishield is that a standard conventional chimpanzee-based adenovector vaccine. This platform has been available for the last 20 years. What we are doing is in the chimpanzee adenovector, we are impregnating the spike protein formula of the COVID virus. Generates antibodies when it is given in 2 successive doses. The longer the duration of the second dose, the better is the immunogenicity, is what is the claim. The only problem with Covishield is that being a vector-based vaccine occasionally can cause fever, pain at injection site, flu-like symptoms, might need paracetamol sometimes, and there is a minuscule association with a little bit of clots. So that is the challenges. It is approved in most places, and ideally speaking, with the concern of Delta strain, we advocate it to be given after 2 months, but it may not be feasible right now for Government of India. So they are advocating 84 days, so which is reasonable. Then, as far as the Covaxin is concerned, it's a killed vaccine. It has to be given in 1 month apart. It may not be as immunogenic as Covishield, but in pregnancy and lactation may be safer because it's a killed vaccine. Again, a very, very old technology. Third vaccine is the Sputnik vaccine. Sputnik is based on two different adenovectors given at 1 month apart. So it has a very high efficacy. So among the currently available vaccines, it has the highest efficacy of 91%. Side effects are similar to that of both Covishield and Covaxin are effective against the Delta variant. The side effects of Sputnik are similar to that of Covishield and Covaxin, predominantly like Covishield, but maybe a little lesser. It is again a new vaccine, very good efficacy, approved many countries, more than 60 countries in the world, safe, effective, and has to be given at a short duration of interval. The fourth vaccine coming up is the Moderna mRNA vaccine, not tested in the Indian population. Very good data of 94% efficacy from the United States, has some data on the variants of concern. So that is where it stands. And the fifth vaccine, which will be available in India, is Hydus DNA vaccine, similar to mRNA, will need 3 doses for its full immunogenicity, but again is an investigational vaccine. All these vaccines are emergency use authorization vaccines. Whichever vaccine, as early, as quickly you can get, you should take. Now, if you are having an underlying major disease, like an immunological disease, rheumatological disease, cancer, transplantation, then please talk to your specialist doctor and they may choose a vaccine or two above the other. But currently, my recommendation for everybody is whichever vaccine you can get as early as possible, get yourself vaccinated and try to complete both the doses as quickly as possible. So that is what my suggestion is to everybody. So Rahulji, I have a question. Simranji is asking that my mother is 44, has high CRP, high LDL. Can you please suggest that with high CRP and high LDL, she should take a vaccine, and what precautions she should take? And Gargia Maheshwar is asking, Garika Maheshwar is asking, is there any food restriction when you go to take a vaccine? And if somebody is having a little bit of jaundice or anemia, can they take the vaccine?
So, Maheshwari ji, Gargia ji, there is no food restriction after vaccination. You can have your normal diet, you can have an exotic diet. Absolutely fine to have any food which you feel like eating, which you would normally eat. About the second question which you asked, that if you're suffering, somebody suffering from mild hyperbilirubian anemia, should they take vaccine? Absolutely, they can take a vaccine. There is absolutely no problems with that. Simranji, if your mom is 44 and she has a high CRP and high LDL, I don't know whether it is LDL or LDH that you are asking. If it is LDL, then it's a low density lipoprotein, which is a completely different thing. It's got no bearing. But a high CRP and a high LDH, I would probably seek a medical advice. See your doctor first. Make sure why is the CRP and LDH high, because they are not supposed to be high. Now, if they're just 1 or 2 digits above the normal range, I think it's probably all right. But if they're significantly high, so you need to sort of see a doctor and then decide why they are high before you decide to take a vaccine. It is always good to wait, make sure that you are baseline healthy before you go in for a vaccination, because unfortunately, if you do have a fever or something, then it will be difficult to understand which vaccine related fever is this problem, or is it a problem because of the disease which you may be having. So it's better to see a doctor. So,
It is
sir, there are a
LDL.
couple
You
of.
have said it is LDL, not LDH. LDL.
It is LDL. Okay, so LDL has got no bearing on the vaccination. Please go ahead, Simranji, and take the LDL. But CRP still is a worry for me. And if the CRP is high, just speak with your doctor quickly. Make sure that there is no real reason for the CRP to go up. Usually, CRP is an inflammatory marker. If it goes up in cases where there is either an infection or it could be an inflammatory process which is going on in the body. So it's better to sort of just be sure on the side of caution rather than going ahead and taking the vaccine before being analyzed about that. So, sir, there's a question by Rajat Kumar Pal. आफ्टर रिकवरी ऑफ कोविड एज 27 कोवैक्सीन लिया 5 दिन हो गए, मुझे वीकनेस एंड चेस्ट हेवीनेस लग रहा है, क्या करूं? That's the first question. And the second question is, I think Yogesh Patil, we have answered the question that which vaccine you would recommend for pregnancy. Then Saeed Ji is asking, which vaccine is good if you have an option to choose for a patient who has got blood pressure, who is diabetic and blood thinner, and they have recovered from COVID 45 days ago. So, two questions.
So the first question which was asked was about Covaxin and little feel of fatigue and tiredness. So that probably needs a little vigilance. You need to stay connected with your doctor. If required, take some paracetamol, take rest for a week or 10 days if required. So this question is a very good question, that if you have hypertension, diabetes, blood thinners, and you recovered from COVID 45 days back, I would wait for 90 days for the vaccination. Probably if there is accessibility to Covaxin, that would be my first choice. But if there is no access to Covaxin, I will take whatever vaccine is available to me. There is no major contraindication for any vaccine. Okay, Rajat Kumar Palji is asking Rahul, after
Yep.
recovery from COVID at age 27, Covaxin ke liye, that is the question which we just answered. So,
Yep.
Mr. Jain has asked, ki my parents took the second dose of Covishield and now they feel tiredness and pain in the legs. So what should they do? That's number one. And Tansia Tabassum ji is asking that before we do the second vaccination, do you need to do an antibody test?
So, Tabassumji, the answer for your question is very easy. Please do not do any antibody test before any of the vaccines. It is absolutely not necessary. It will only confuse your decision, and perhaps you may then be forced to wait within your own mind that why should I be taking a vaccine, which is not the right policy right now. The policy is to take the vaccine on schedule so that you are fully immunized. The second question, which Jackie Jainji is asking, that their parents have completed the vaccination schedule on the 19th of June, and now they are feeling tiredness and pain in the legs. Now, this could be a fatigue, which has probably no bearing with the vaccine relation, absolutely. So, I would say that first of all, see if there are any other symptoms with that. See if their days have been more hectic and heavy than what normally they have been having, and see if there is any swelling in the legs. Because with Covishield, there is a small chance that they may be developing clots in the leg, which again, both of them having is a very unusual thing. I would probably not put too much of importance on the clots right now. The other thing to ask is that is this a COVID breakthrough infection or any other viral infection? Because the only infection related symptom which may present for a fully vaccinated person may be a non-specific body ache or a pain in leg and tiredness. So it's important to see if they have been exposed to somebody who was positive, and just on the side of caution again, seek a doctor's advice and get their test done if there is any suspicion there. So a couple of questions by our viewers. The first one is Kalpana Ji is asking which vaccine for children are likely to be available in India. And again, Rajat Pal Ji is again asking the question that left side mein heaviness lag raha hai after the vaccine, the Covaxin question. So I think if you could just again reaffirm him and just reassure him, that would be good.
Rajat ji, feeling constant chest pain and pressure, go and see a doctor and get a ECG done. It will allay your anxiety and you will get a medical checkup done. As far as Kalpana ji is concerned, the first thing is for children, no vaccine is available in India. But for all children, we recommend a complete vaccination for children as per Universal Immunization Program of Government of India should be completed, and there should not be any disruption on the same. So that is the primary thing which you have to do. And there are vaccines like BCG, polio, measles, and flu, which may have some indirect way of boosting immunity. So if COVID happens, they will be able to recover faster. So these are our last couple of questions, Rahul ji. I want you to answer one question and then probably give a take-home message on
Sure,
vaccination in
sir.
general, and then of course I'll give my final verdict. Lovin Marjaria is saying that arthritis patient, can they take a vaccine? Because a lot of people are scared with arthritis to take the vaccine. And there is another question which was earlier asked. Pawan Gupta ji asked that can we have alcohol after taking the vaccine?
So I think this alcohol question is very commonly asked to all of us, and my answer is that yes, you can take alcohol, but in general, alcohol can be avoided by most people. So if you can avoid alcohol, not for any particular reason, but for your overall good health, you could probably avoid it. But if you have to take it, there is no contraindication to it. As far as the arthritis is concerned, I think the concern of Loveleen Shi is absolutely valid, because many of the arthritis patients are on actually immunosuppressive therapies like methotrexate or steroids like prednisolone. But believe me, Loveleen Shi, these are the patients we want to protect. These are the very patients in whom there is a high risk of them catching an infection and becoming positive. So please go ahead and vaccinate the patient who has got arthritis. Absolutely no issues with that. Just one word of caution there. Some of the severe arthritis patients, rheumatoid arthritis patients, are given monoclonal antibodies like rituximab nowadays. And if he is on that kind of a medicine, then speak with your rheumatologist or the physician who is treating their arthritis, and make sure that you have a good safe window of opportunity to take the vaccine, because this vaccine will be best taken up when you're not on the rituximab as such as a continuous therapy. You may probably plan it before the dose of rituximab, around 4 to 6 weeks before the dose of rituximab, if at all he's on rituximab. But if not, just normal steroids or methotrexate or any other medicine like painkillers, go ahead and do it. So, sir, I think that was the last question. My take home message for everyone would be that vaccines are supposed to give us immune response, which will help us not only getting from, which will help us to protect not only from getting a severe or a moderate disease, but will also save our life, because it actually saves us from mortality as well. It will definitely not provide you 100% protection against getting a disease. You may still become COVID 19 positive, but it will be a mild or a asymptomatic disease only. And with that, you will be able to protect yourself and your family and people who are dependent on you. So, my urge to everyone is, please vaccinate yourself. And a second important point to note is, even after you've completed your vaccine schedule, please continue to wear a mask. Do not let your guard go down for COVID 19 behavior at all, at any cost. Please do that. Thank you very much. And, sir, for the final word to you.
So thank you, Rahul ji. My final take-home message is encourage positive behavior. Share correct and credible information on COVID-19, COVID behavior and vaccination drive. Counter hesitancy, myths and rumors. Get vaccinated on your turn and share a very positive experience, and ensure that you take care of your psychosocial well-being and not only support yourself, your friends and families, but everybody around us. We are in for tough times. We have been able to swim through the journey for the last 1.5 years. It's a matter of the last 6 months. And as we conquer COVID and we move towards a COVID-free world, we need to understand that we have to overcome this by countering a lot of negativity with a lot of positivity. So I think let's be all positive. Let's try to vaccinate as many people as quickly as possible. Let's try to mask and double mask. Let's ensure that we move towards a COVID-free India as early as possible. I'm sure that we will be back again for another show of Med Talks next week. But I'm sure that you will have another show coming immediately next, tomorrow, of the KK Med Talks. We really miss Dr. KK Agrawal, and this show is dedicated to him, and the legacy lives on. And I once again request each one of you to follow COVID appropriate behavior, COVID appropriate protocol. Get yourself vaccinated, ensure that your vaccination is completed. Be alert, stay safe, stay happy. Thank you once again as we close down the curtains on one more KK, Dr. KK's Med Talks. Namaskar.